Hello, everybody. This is Dr. Hanif Zakaria, Mahir Amraz Sina Vadama. Today, we are going to talk on diabetes mellitus, which is a very misunderstood disease but very easy to take care of. Now, what is diabetes? Diabetes is that when your glucose level, when your sugar level in your blood is higher than normal. Now, what are normal levels? At a fasting state, your normal level should be between 70 to 110, stretchable till 115, 116, no problem. And post lunch, or you say random sugar, that any time of the day that you take, it should be from 80 till 180. Now, what are the causes of diabetes? That is, your sugar level is higher than normal. What are the causes? Now, the causes, of course, the diet is there, your lack of exercise, all these are there. But first, let us come to the types of diabetes. Now, there are three types of diabetes. That is type 1 diabetes, that is in childhood that you have, where your insulin is not produced. Insulin means लबलबा, pancreas that you call. उसमें इंसुलिन नहीं पैदा होता है किसी वजह से ड्यूरिंग द प्रेगनेंसी द मदर इज अफेक्टेड ड्यू टू द इन्फेक्शन और देर इज सम ऑटो इम्यून प्रॉब्लम विच ब्रिंग्स अबाउट lack of insulin means no insulin. So insulin is the only treatment that is required, that is in type 1 diabetes. Type 2 diabetes, that is also called maturity onset diabetes, where your insulin is produced by the pancreas. But what happens that the insulin that is there is not utilized by the cells due to some reason. That is the resistance that is caused. So you have to take insulin sensitizers. And number 3, you have gestational diabetes. Now, gestational diabetes is diabetes during pregnancy. So once the delivery takes place, your diabetes comes down, your sugar comes down, you're absolutely normal. But you have to take care so that in future you don't get diabetes. Now let us go ahead with the different types of diabetes. In childhood diabetes, that is type 1 diabetes, you have to take insulin. So you see what happens that patients or in fact the parents of the child, they run around from here and there, and there are, you see, people, you see, they want to avoid insulin. So let me make it very clear that insulin which is not produced by the body has to be given from outside. So that is the only treatment, and the child will be absolutely normal. Let him take insulin, that is it. Now we come to number 2, that is type 2 diabetes. There you see you have to take care of your exercise, you have to take care of your diet, you have to take care of your obesity agar if there is, you see, overweight is there. Now what do we do is that when type 2 diabetes is there, we first, you see, the level of the diabetes that is there. Suppose if it is more than 180, but if suppose if it is less than 250, 240, if it is there, we avoid any medicine. We see that if we can control it with diet and with exercise, and see, consistency is very important, not the intensity, the consistency of exercise, consistency of a healthy diet. Then you see you can take care of your diabetes for a long time. There should not be any problem. So you see, then you it is like, you don't have to avoid things. You have to take things smartly. That is the main thing that you have to do where diabetes is concerned, type 2 diabetes. Now you see, you will come to know a patient who has got diabetes will urinate more, will have excess thirst, will, you see, lose weight, or suppose he gets a cut, it will not heal, there will be infection. So these are all these chances that you are having diabetes. So have yourself checked up. That is what it is. But what I want to bring to your notice is that where diabetes is concerned, There is nothing for to get panicky about it. Only if your diabetes increases too much, that is goes more than 300 or so, at that time then you have to take precautions, and you have to be very very careful. But if it is in that range, if you take a little bit of precaution, and ultimately of course you have to consult a doctor, you consult a doctor. But what I want to bring to your notice is that I want to empower you, I want to bring an awareness in you. Once that empowerment and awareness is there, the doctor will also enjoy talking with you, that you are aware, and he'll be able to explain to you, you will be able to understand in a better way. That is what my this intention is, to bring about this video. So take care, and let us hope for the best. And one more thing I want to tell you, why that the amount of diabetes in Pakistan is not less than 26 to 27%, and we are the third highest in terms of population in diabetes. China, India, all these are, you see, behind us, but they are also having a good amount of diabetes. So let us, you see that we bring about a change in our diets and in our exercise. Diet means, you see, avoid all these your carbohydrates, chips, colas, all these things, you see, if you avoid, and if you have a very balanced diet, leafy vegetables, more of vegetables, avoid beef, and do regular exercise, then all the best.